Our next presenter is Dr. Prem Sahasranam. He's a board-certified endocrinologist and the CEO of My Diabetes Tutor. He has 15 years of experience taking care of patients with diabetes, and he's a graduate of Madras Medical College and with postgraduate training in endocrinology. He founded Central Valley Endocrinology. It's a clinic. Soon he discovered that people living in rural areas have had more complications. So that's why he founded My Diabetes Tutor. So he is right here in California. Welcome, Prem. The stage is yours.
So thank you, Lee. Thanks for inviting me to My Diabetes Tutor. I'm Dr. Prem Sahas. I'm a board-certified endocrinologist. I'm the founder CEO at My Diabetes Tutor. And My Diabetes Tutor, it's a telehealth program for diabetes education. And what we are doing at My Diabetes Tutor is we are addressing the critical gap in diabetes management. As physicians, we know perhaps with no other disease does education make a difference to life and limb. So diabetes education is so important. So I would like to share a story why I started My Diabetes Tutor. I've been in practice since 2007, built a very successful practice in Central Valley, which is an underserved area, consulted over 35,000 patients. And the reason for my success is I always invested my time in having diabetes education in my practice. In 2018, I had 2 full-time educators in my practice. And in 2018, my educators decided to retire. And I was trying to recruit educators from other parts of the country to my underserved community, Central Valley, and I had no success. So I decided to build a telehealth program, build team, contents, technology, get accreditation. And the company was founded in 2019, and we went live in 2020. That's the story. But we know diabetes is a growing issue. If 1 in 2 people in the country have prediabetes or diabetes, and the prevalence is 9.1%, more than underserved communities, and projected to increase to 18% in 2060. So it's growing. And diabetes, you have controlled and uncontrolled diabetes. And uncontrolled diabetes leads to health complications, increased healthcare utilizations, and increases the cost for providers, payers, and patients. And vast majority, 75% of the patients have uncontrolled diabetes. So, and diabetes, we have to control diabetes, and diabetes education is proven to help. Diabetes education can reduce A1Cs. It has been shown to reduce A1C by 0.73 points at 12 months and is recommended by all bodies, ADA, AMA, CMS, CDC, everyone. And diabetes needs to be controlled. Education is effective, but people have no access to diabetes education. And the patient, only 5 to 7% of the people with diabetes receive education during the first year after their diagnosis. The reason is lack of access and availability, very pronounced in underserved communities. And really look at if you take only 62% of the non-metropolitan counties do not have a diabetes education program. So My Diabetes Tutor is a health equity solution. So it's a tech-enabled platform with a human touch, MDT leverage, one-click user access to provide unparalleled education experience for people with diabetes. It's one click, no need to download app. It's if you click, you can connect to the educator. And we have grown since 2020. We are a team of 21 diabetes care and education specialists. We provide education in multiple languages. Most of our sessions are one-on-one video visits. It's covered at 100% by most plans. We are contracted with Medicare, CMS, California Medicaid, all commercial plans, most of the commercial plans, Medicare managed care plans and Medicaid Advantage, Medicaid plans. So it's a tech-enabled, it's scalable, it's the right solution for a value-based healthcare delivery model and a win-win for patient providers, health plans, and health systems. So most of right now our visits are one-on-one video, but we are also integrating a AI chat end of this year, 2024. So patients can have chat sessions between visits, between sessions. So how most of our patients are receiving education via video visits, but working for an underserved community, we realize 10% of the patients are non-tech savvy. So we mail out contents to their home and just hold audio sessions. And few clinics have provided like kiosk. So where the clinics, the staff at the clinics check in the patients and they receive education from the clinics. So it's a large scale growth opportunity with a recurring revenue built. Right now, 14.3 million people in the country need diabetes educations. The time is around 7.5 billion, and recurring is 1.8 billion. So Medicare typically allows like 10 visits during the first year and 2 hours of educations during the subsequent years. We can also add like medical nutrition therapy, and patient, if they enroll to our RPM program, patients can have visit with the educator once a month. So our business, all stakeholders in diabetes care have vested interest in driving diabetes education growth. Our business model is unique. We collaborate with health plan providers, health systems, employers, partner with medical device companies, and patients can also self-refer to us. So founded in 2020, most of our growth happened during the end of 23. And I would like to highlight a year of achievements and market validation. So MDT, our monthly visits grew 3x in 23. And we reached our milestone over 12,000 patient encounters. We did a close safe capital seed round last year for the 1.8 million. We also diversified our revenue stream, adding direct contracts with device companies and therapeutic companies. We deployed a CRM system, implemented a marketing outreach program, demonstrating a scalable growth model for physician referrals. We leveraged automation to maintain our operating margin and improve patient experience with scheduling and onboarding. So want to highlight our A1C reductions. It's 2.6 points and 4 points in 2 recent patient reports. Our outcomes are outstanding and still maintaining a patient satisfaction score over 98%. 98%, over 98% of the patients said they would refer their family and friends to My Diabetes Tutor. Also added an RPM program and device support program in 2023. So if we look at our growth chart, 2020 to 22, we were mostly running pilots. And 23, we started seeing growth. And in 2024, we are shooting for 12,000 visits. We are on path to growth, expecting like 12,000 visits. And I want to highlight our outcomes, patient outcome. We are the preferred providers for TRICARE and military. So TRICARE referred over 100 new onset diabetes patients to us last year. And we showed an outcome, A1C reduction of 4 points for the TRICARE patients, where the national average is 0.73. And we also worked with the largest FQHCs in California, United Health Centers, referred over 450 patients to us last year. We showed a 2.6 point reduction in A1C. So our outcomes are outstanding, way higher than the national average, still maintaining the patient satisfaction. So 98% of our patients said they gained lots of knowledge, and 99% said they would refer My Diabetes Tutor to others. And 96% of the patients found the program good, and 97 said the quality of instruction is good. You don't have that many healthcare companies which can boast a 98% patient satisfaction. This is based off a survey we sent end of last year, and this is the outcome. This is the patient response. And as a founder, I invested 200K to build the company. We did a safe round in 2023 for 1.8 million. Our company is generating revenue. We generated 569K revenue in 23, and we are on path targeting 1.5 million revenue in 24. We are opening a Series A round this month, and our goal is to raise 4 million capital for achieving 4 million revenue in 25. We anticipate a break-even, cash flow break-even in 26. We are doing this round at 19 million post-money valuation, targeting a 3x growth for 25 and 5x in 25, still maintaining a gross margin 38%, launch AI by 24. We are growing nationally and want to expand nationally, add new services, reverse training and RPM. And forecast 28, we are expecting, we want to reach to a 45 million revenue, and we'll break even in 26. I want to showcase our market. We have an outstanding clinical team. That's our patient outcome is good. But we have a seasoned and driven management team. Combined, we have worked for over 50 startup companies, VC backed, and we had successful exits. Would like to collaborate with you to grow My Diabetes Tutor, and thank you.
Thank you very much, Prem. Thank you for that great presentation. One of the questions, well, I'm sure the audience have many questions, but one of the questions I had was, now there is a lot of push to make tech the main thing and get rid of people. So you are going against that grain. You're saying that tech plus people is what is needed.
Yes.
What is your answer to that? You know, when
So I think, you know, AI cannot replace physicians and providers, and technology is important. It has to go in hand with we need a human touch to have the patient satisfaction and improve the outcome. And AI will just to help the providers to deliver care better. That's my opinion.
Okay. And also, is that your experience with what you're doing?
Yes, and we in end of 2024 we will be integrating AI. So AI will be able to answer the frequently answered FAQs, frequently answered questions, ask questions, and I think it's going to help the patients, but we still need the provider to take care, deliver care. You know, it's not going to replace the providers.
Good point. Good point. All right. Are there any questions from the audience? You can unmute yourself and.
I'm sorry, I've got one comment. I really like the presentation, and I'm not sure why this just is peppering me, but did you consider a business model where you're enabling individuals to become experts in diabetes education that could teach their peers with diabetes and partake in some of the revenue that is being generated, so as to more quickly disperse the kind of like a snowflake model, right?
That's an interesting model. I think we'll be.
Can I answer that, Prem?
Yeah,
so,
Adam, go ahead, Adam. Adam is our CEO.
Yeah. Well, so the revenue model is primarily insurance-based. So sharing information with peers, there are an awful lot of diabetes peer groups, and we certainly support them and encourage them for peer-to-peer information, but that's not our business model. Our business model is based on being 100% covered by most insurance plans and having the ability to, serve the market that's really underserved. And that's really the key point of what we do. The other key area of revenue that's emerging is a lot of the device manufacturers are finding that they're having a hard time having doctors write scripts because doctors don't have the time to train the patients on how their devices work, whether that's pumps or continuous glucose monitors or inhaled insulin. So we're getting a lot of interest where they're reaching out to us because they have heard about our ability to deliver quality education to patients. And they want us to train for them, and they pay us directly, the manufacturers do, for training their new patients on whatever device or therapy. So I think the key is with the multiple education sessions, anywhere from 3 to 10 typically, you have the accountability and the relationship with a single educator over time. And spaced interval learning is really what changes human behavior. And if you're not changing human behavior, you can have 1,000 pages on the internet of diabetes education, and you don't have a relationship, you don't have accountability, and it doesn't work. It's proven not to work, as a matter of fact. There's so many wellness apps out there. So what we're doing is clinically effective. I would challenge anyone to find where you would improve A1C by 2.6 for a population of 450 FQHC patients. So I think the model we've chosen has evolved because it works and because our educators are generally very tenured people that know how to build relationships with people and help them through their journey, whether they're initial diabetics or diabetics that have never been educated.
Great. Thank you, Adam, for answering that question. In other words, this is a different business model and which works. I guess that's the answer. I'm guessing you're saying.
Yeah.
Ravi has his hand up. Ravi?
Yeah, hi.
You have a question?
Prem, thank you for number one, getting into this world of diabetes improvement and trying to make a difference with technology. And I myself have been trying to skin this in a different manner. I'm an obesity medicine doctor. I'm an infectious disease and wound care doctor. I work on diabetes reversal my way. I'm worried sometimes when to hire a diabetes educator. I've been always worried about the thought process and the process in which ADA teaches the diabetes educators as insulin pushing agents. And I'm a low carb doc, you see, and I sit down, teach every hour. I waste a time, but sometimes I'm very successful and keep them on. But sometimes I reverse the diabetes and they come back after a certain time and I get frustrated. But if I have a good coaching hand that fits to my philosophy, the options are huge. And I have around, on our platform, I have around 250 patients. I'm an infectious disease doctor doing all these things. And
what's your question? Do you have a question?
The question is, what is your philosophy regarding this coaching? Do you fit as per the guidelines, or do you fit to personalized nutrition or the professional practice guidance?
So we follow it's a program is accredited by the ADCS. We follow the ADCS recommendations. And during the visit, we do customize each for the individual patient. So we do an assessment visit during the first visit and individualized care. And I can tell you one thing here regarding reversal of diabetes. It's basically, it's the reason ADA recommends and they have a guideline for diabetes education is because you have to find a solution where the people can follow and sustain and follow it long term. Reversal of diabetes is short term. Many programs, many health systems have tried it, and it's a short term success. We have to find a solution which they can do over the period of next 40 years.
Yeah, I mean, obviously, success is guaranteed if there is a handhold, and there are programs like Verta that have done that. at their own level. But programs like this, if attached to significant payment process, I think can be delivered at scale. So
Thanks,
hope it
Ravi.
works out for you. But if there is a way in which we can work with the process that I discussed, I'm open for discussion.
Thank you, Prem, for
Thank you,
great
Oli.
presentation. And we are looking forward to your investor deep dive next month, right? So